We are back on midday now with a question some parents might be asking this fall. Should my kids get the new COVID vaccine? The CDC authorized an updated vaccine for everyone 6 months and older. Health officials say this new version targets the latest variants, and they're urging people to get the shot by the end of October. But when the last vaccine came out last year, according to NBC News, just over 17% of those eligible to get the shot actually did. To help parents gather all of the information they need heading into cold and flu season, we're joined now by Regena Spratling. She's the president of the National Association of Pediatric Nurse Practitioners. Thank you for being here this morning.
Well, thank you for having me.
So there are different opinions out there, of course, on COVID vaccines, especially when it comes to kids. We've all been on social media. We've seen all the opinions. So what would you tell hesitant parents who are debating whether their kids should get the shot this fall?
Well, I would say that the vaccines are safe and effective. They have been tested in clinical trials with children, and then millions of doses have been given to children, and those doses have been continued to be monitored, and these vaccines have been proven to be safe and effective.
In the past, vaccines have been a different dose for kids. They haven't gotten as much as we've gotten as adults. So what do parents need to know about this vaccine for this fall?
Well, for the fall, if you have a child that's 5 years of age or older, so if you have, again, a 5-year-old child or older, an adolescent or an adult, they get one updated booster. It changes when they're from 6 months of age to 4 years of age. So if they've received a previous vaccine, then COVID vaccine, then they may need 1 or 2 doses of the updated booster. If they have never received the COVID vaccine and they're in that 6 months to 4 years of age, then they would need 2 doses of the Moderna or 3 doses of the Pfizer vaccine.
So just make sure you have your records and you know what your kids have gotten. This is also the first year that 3 vaccines are all available at the same time for typical winter viruses. There's the COVID shot, the flu shot, and some people can get the RSV shot this year, including kids. So how can parents prepare for that?
Well, you know, I mean, they're all great vaccines and, again, safe and effective. The COVID and the flu can be given together. So you can take your child to your pediatric healthcare provider or the health department, and they can receive both of those at the same time.
And then can you help explain this to us, that this is a brand new vaccine? They're calling it a vaccine and not a booster this time. Help explain that.
Well, you know, that's kind of language. I mean, I think we're talking about the same thing. So I don't want to get anyone confused as far as those different terms. I mean, they're all vaccines. And then a booster is typically when you've had a previous dose of a vaccine and you get kind of boosted with a dose of vaccine. So we're really talking about the same thing.
All right. That was Regena Spratling. She's the president of the National Association of Pediatric Nurse Practitioners. Thank you for being here this morning.
Thank you for having me.